Hi everyone. We are here in class today online, and we're going to be talking about colon procedures and male reproductive health today. So let's get started by talking about some of the procedures that you will typically see performed in the medical office. The first is the fecal occult blood testing, which you have already been given a kit to finish and complete at home this week, and you'll remember to bring those to lab this week as well. The other test that we have is what's called a flexible sigmoidoscopy, but I will tell you that typically this is done as a full-fledged colonoscopy, and it's done usually in an outpatient setting. So with the fecal occult blood testing, we talked about in class that a lot of times people are really embarrassed and reluctant to actually perform this test at home. And part of the reason that you're performing the test is so you have a better understanding and can have some compassion for what your patient's experiencing. And that way, you can talk to them differently, and hopefully the patient will be a lot more likely to participate and complete the test because it's a really important test. So we're going to be doing the fecal occult blood test in class today. And the reason it's an important test is that blood in stool can either be bright red and prominent, or it can be hidden. But anytime there's blood in stool either way, it can tell us that the patient might be experiencing hemorrhoids, diverticulosis or polyps, colitis, ulcerations, and then the main reason we're running the fecal occult test for a patient is to screen for colorectal cancer. So some of the conditions that happen within the GI tract will produce really visible bright red blood when a patient has a bowel movement, and it'll either be on the outside of the stool or the water in the toilet bowl will be kind of the bloody red color. And so when this happens, we know that a patient is having active bleeding. And one of the main reasons this happens is because of hemorrhoids, which can either be outside of the body or inside of the body. And when a patient has a bowel movement, it triggers bleeding, and so we can see evidence of that. But some conditions, we can't see blood. Now, one of the things that sometimes will happen as well is a patient will develop melena or melena, which is a black tar-like stool. And this happens when blood comes into the stool from the upper GI tract in larger amounts, 50 milliliters or more. And what happens to the stool is that it takes on this tar kind of like black appearance. And it happens because the iron in the blood starts oxidizing, and that's caused by enzymes, bacterial enzymes in particular. So what we're concerned with, and the reason we run the fecal occult blood test, is we're looking for blood that is hidden to the naked eye or invisible. It's being secreted in such a small amount that we literally can't see it. And the only way we can detect it is through either chemical testing or looking at the sample under a microscope. So colorectal cancer is actually the most common, form of cancer in patients that are 40 and over. And in the very beginning, during the asymptomatic stages, remember that means a patient isn't experiencing symptoms. Most of the tumors, and a neoplasm means new growth or tumor, that we find in the colon and rectum only bleed a little amount every now and then. And this creates hidden blood. It's really important for us to detect this early, though, because if we can diagnose it early, that means the patient is going to receive treatment and it's going to increase their survival rate and ultimate prognosis. So, when a patient moves out of the asymptomatic stage and some of the symptoms start appearing, this is usually when the colorectal cancer has advanced, and it can become really serious because treatment of colon cancer will depend on the stage and the extent of the disease that the patient is experiencing. So, when a patient starts getting symptomatic, what we typically see is visible bleeding, their bowel habits will change, they can start experiencing abdominal pain. Sometimes they'll even feel referred pain in the back or in the thighs. And this is not good. So, this is one of the reasons we really want to catch it early in advance. The way that we do this is by using a test most often ordered to work as a screening tool for the occult or hidden blood in the stool. And it's called a guaiac slide test, which is exactly what you're running at home, the fecal occult blood test. It's a synonym. And you'll see different brand names out there, Hemoccult, Serocult, Coloscreen, and sometimes you'll see them in packs of three, like the three cards, which is the ones that you all have. Or sometimes there'll be an individual test card for the patient to screen once. The reason we're doing the fecal occult blood testing again is to screen for and either rule out or find occult or hidden blood. And colorectal cancer screening is the primary reason that we utilize this, but it can also be used to help in diagnosing and determining if a patient has upper GI ulcerization, ulcers, or any kind of disorders or diseases that cause irritation within the stomach and intestinal tract. So we are going to run this test, and if a patient is having blood loss that is hidden in the stool in excess of 5 milliliters a day, it's going to give us a positive reaction in the test. It's important to realize that many people may normally lose up to 3 milliliters a day of blood, and this will just be a result of minor bleeding within either the nasopharynx, the throat, the nose, and the GI tract from little minor abrasions or the foods that we eat that irritate the lining. But the test won't show positive unless we hit that 5 milliliter or more mark. And what's going to happen if you look at the slide here, we're going to be testing in class using a developing solution. And if you see any blue colorization around or touching the stool, it means that that specimen actually contains blood. So if you look a little closer here, we can see the top picture is showing negative smears. We'll see an area of clearing where it's just clear and there's no detectable blue color on or at the edge of the stool smear. And that means that we have a negative. Every once in a while, you'll get a negative and a positive. So remember that you're testing your stool twice each time. So in the bottom left picture, you'll see that on the left-hand side, there's no color blue, which indicates negative, but on the right side, the stool specimen has some trace of blue touching the edge, which is a positive. And then on the picture on the right, we see that both of the specimens that were taken from different places on the stool show a positive. So if we get a positive test, the cause of the bleeding has to be determined in order for the doctor to make a diagnosis. And what's going to happen with this patient is they're going to be undergoing additional diagnostic procedures. The most common is definitely going to be the colonoscopy. We'll touch upon and talk a little bit about sigmoidoscopies, but you might remember that the sigmoid colon is only a very small part at the end of the colon. Whereas a colonoscopy is a procedure that will visualize the entire length of the colon. And this is typically what is going to be performed if a patient has a positive test for the fecal occult blood testing. Now, when a patient is going to be performing a fecal occult blood test at home, you might remember we talked about some of the preparation and guidelines in class that a patient may need to follow to be sure that we get accurate test results. Remember that the physician or provider is the one that needs to be giving the orders in terms of what the patient should or should not be doing. So be sure that you get that information from your provider before advising a patient. But if the patient is performing the preparation and guidelines to a T, they're going to need to start a special diet 3 days before the test, and they're going to need to continue until all three slides or tests are performed. So one of the things they need to do, remember, is to have a red meat-free, high residue diet, and they're going to start eating that high fiber diet ahead of time. And the reason they're doing this is because it will encourage bleeding from different types of lesions or little cuts along the GI tract that may only bleed periodically. So when they eat food that has fiber, like whole wheat, bran, fresh and dried fruits and vegetables, that fiber adds bulk in the stool, and that will encourage bleeding. It also helps promote elimination. So, other words, if we eat a high fiber diet with plenty of fluids, we tend to have more productive bowel movements, and that makes it easier for the patient to collect a stool specimen. Some of the best fibers to include in a patient's diet during the test, before and during the test, would be lettuce, spinach, corn, celery, apples, bananas, oranges, peaches, and of course, again, whole grain breads and cereals. And again, the diet should be meat-free, meaning no red or rare meats, because it contains animal blood, which could give a false positive for the fecal occult blood test results. So some of the meats that your patient will want to avoid would be beef, processed meats, organ meats, liver, lamb, those types of meats that contain blood. It would be okay for your patient to have small amounts of other meats like well-cooked pork or poultry and fish, where it's unlikely, if they just eat it in very modest amounts, to have a false positive. But the interesting thing is that there are some foods that are very healthy that have peroxidase, which is an enzyme that could actually cause a false positive result. And many of these foods are things that patients would eat readily. So we would want to have them avoid eating foods like broccoli and cauliflower, melon, radishes, turnips, horseradish in particular, because they could cause a false positive result. The other thing that we need to be aware of is that there are many medications that can actually irritate the gastrointestinal tract, and that could cause some bleeding, which would then lead to a false positive result. So, for an ideal test, 3 days before the test, patients would discontinue taking any corticosteroids. 3 to 7 days before the test, they might be advised by, again, the provider to discontinue taking aspirin or any kind of NSAIDs, which are non-steroidal anti-inflammatory drugs, some of which include ibuprofen and naproxen, which would be like Aleve. And there are other forms of NSAIDs that are prescribed, and even some high blood pressure, hypertension medications might need to be avoided. But that again is going to be determined by the physician. Another thing a patient may need to discontinue would be an iron supplement, because if iron is taken in excess, it can actually cause a false positive, as well as vitamin C, which, if taken in excess of 250 milligrams a day, might actually cause a false negative. And these are things that patients, typically or readily take. So again, you're going to want to check with your provider to ensure that you understand the appropriate instructions to provide to your patient. And the other thing that should happen is that to prevent a false positive, if any patient is experiencing active bleeding, so females, the first 3 days of a menstrual period, or for both males and females, if there's any bleeding from active hemorrhoids, ideally we don't want them to perform the test. But for our test and what we're doing in lab this week, please go ahead and perform your test, even if you're experiencing even either one of these conditions. We talked in lab about quality control and how important it is, both with tests that we do manually, like the fecal occult blood test, or with tests that we use automated analyzers. So, quality control are measures we take to ensure that we can rely on the test results and that they're not erroneous. And so, with the fecal occult blood test, when you come into class on this week for lab, we're going to not only perform the test, but you're going to see that there's a built-in quality control that we have to use with the developing solution and take a look at it to ensure that we can rely on the test results. Slides contain a built-in control. Now, the picture you're seeing here is for a hemoccult test. The one that we're going to be utilizing could be a little bit different. But either way, the developing solution we need is going to create a scenario that allows us to see a positive area, which should turn blue. Because on a test, an actual test that a patient runs, if they have a positive test result for hidden blood, that result would turn blue. And the negative area should not change color. It should stay clear or white, which is what we would see in an actual patient's test as well. If quality control measures fail to turn and we don't see what we expect with the results of the controls, we can't rely on the test results. And so we need to rerun the test. It could be a number of causes that cause the controls to fail to turn appropriately. We could have the cards themselves are developing solutions that are expired, so it's super important to check that. There could be an error in your technique, maybe adding too much of the developing solution. The other thing that could be that the slides were not handled properly when the patient had them. So they might have been exposed to heat or sunlight or strong fluorescent light that changed the test and then provided us with inaccurate results. I'm not going to go too much into a sigmoidoscopy because I want you to remember what I said earlier, and that is that if we have abnormal results for a patient, they're typically going to have us send out and go to an outpatient facility and have a full colonoscopy. But what a sigmoidoscopy is, it's when a doctor, a provider, visually examines the lower third of the colon, which is called the sigmoid colon. And they use a flexible sigmoidoscope, which is an endoscope that allows us to go into the body with a light, a camera, and take a look at visualization of the rectum and the sigmoid colon. The problem with this test is that it only looks at that lower third of the colon. So the advantage of a colonoscopy is that when like the gastroenterologist or doctor goes in, they go through the rectum, they view the sigmoid colon, the descending colon, the transverse colon, the ascending colon, all the way to the cecum or the very beginning. And then they visualize coming back out as well. And the colonoscope or sigmoidoscope, like I said, has a camera on it. It's illuminated with a light so that it can see. And then the scopes typically have water and air that can be applied to the colon to either distend or open the colon to be able to visualize it more clearly or to clean it out if necessary. So the colonoscopy, again, it's a really important test, and it's considered the gold standard for really detecting colon abnormalities. And it's really important in terms of detecting colorectal cancer for all patients, but absolutely for anyone who has a higher risk involved. Okay, so now we're going to take a look at male reproductive health. Um, there are two areas that are really important in terms of male reproductive health, and the two areas are prostate screening and a male performing testicular self-exams. These types of tests and exams can help detect cancer early, which are, again, super important, just like with colorectal cancer, because early treatment often results in a cure and a much better prognosis for the patient. So, according to the American Cancer Society, prostate cancer is actually the second most common cause of cancer deaths in males. Lung cancer is the most common. And we see approximately 230 to 250,000 men, so a quarter million diagnosed every year. Over 10% of males die from the disease, and the incidence or the prevalence of patients being diagnosed with prostate cancer increases after the age of 50. Now, the interesting thing is that we see prostate cancer more often in African American, Black American males, or in males with a family history of prostate cancer. So, prostate cancer screening is really important. And what they suggest is that males that have risk factors should have PSA testing, prostate specific antigen testing, and physical exams every year starting at the age of 40. And any other men that don't have risk factors can start at 50 years old. So, we need to understand a little bit about the prostate gland before we talk about PSA testing. So the prostate gland is a gland that surrounds the urethra. And you might remember that the urethra is the tube that leads from the bladder and takes urine out of the body. So the prostate gland is located just below the bladder in front of the rectum. And it should be the size and shape of a walnut. And its function is to secrete the fluid that transports sperm. So a normal prostate should be the size of a walnut, and you can see that it's surrounding that urethra, and it should be palpable. It should be soft. It shouldn't be hardened. An enlarged prostate, which you can see in the picture of the right, becomes much greater, and it starts to close off the urethra, which could provide challenges for a male in terms of urination. This particular picture is showing us an enlarged prostate that's due to benign prostatic hyperplasia, which is something, it's abbreviated BPH, which is something males start to experience normally as a result of the aging process. But in the early stages of prostate cancer, just like with colorectal cancer, the patient is often asymptomatic and they don't have any symptoms. But as the cancer starts developing and staging further, the patient might start experiencing difficulty urinating. Remember that that prostate is going to close off the urethra. That could also lead to weak or interrupted urinary flow. The patient could also have pain or burning during urination, might have to get up more at night or during the day to urinate more. There could be visible blood in the urine, definitely something we could see doing chemical analysis. And again, they might get that referred pain in either the lower back, the pelvis, the upper thighs, or a combination of all of the above. When prostate cancer is diagnosed early, the chance of a cure is exceptionally good. And so those screening tests are really important. And the two screening tests that are going to be prescribed are what are called a DRE, which stands for a digital rectal exam, or a PSA, which is a prostate specific antigen test. So the DRE or digital rectal exam is always performed before a sigmoidoscopy or a colonoscopy. And this is a simple procedure that's quick. It's a little bit uncomfortable just for a short period of time because what happens is the provider takes a gloved hand and lubricates the index finger. And then the index finger, as you can see in the picture, is inserted gently into the rectum. This allows the provider to be able to palpate or feel a portion of the prostate, not all of it, because you can see by the finger that there is a portion of it that's inferior, that's unable to be palpated. But the provider is feeling for the presence of any types of hardness, which might indicate tumors or polyps, hemorrhoids, any kind of pain, discomfort, or tenderness that the patient may be experiencing. So I mentioned that the surface of the prostate gland can be palpated, but it doesn't get the full determination. Now, if a provider feels enlargement or an abnormality, the patient can undergo a sigmoidoscopy or a colonoscopy, and then things can be viewed more in detail there. So the prostate gland, again, the size of a walnut, should normally feel very soft and palpable. If there is firmness or hardness as tissue becomes malignant or starts developing a neoplasm or a cancerous tumor, it will become firmer and harder. The other reason that digital rectal exams are performed are that when the provider inserts the index finger into the rectum, it relaxes the muscles called sphincter muscles and it makes it easier for insertion of the endoscope. So females will also get a digital rectal exam as well, not to palpate the prostate, but to feel for any areas of abnormalities and to assist if a sigmoidoscopy or colonoscopy is going to be performed. The PSA test is a blood test, and this is a test that is ordered for many men. And what the goal is it's measuring an amount of what's called prostate-specific antigen, which is a protein that is normally produced by the cells of the prostate gland. Okay, so the prostate will release, PSA into the blood, and then this test is going to check the levels. So PSA levels will elevate or increase or become higher in men that have both benign, non-cancerous, or malignant cancerous growths surrounding the prostate. And the higher the PSA level that we get out of a blood test, the more likely cancer is present. But it's not always the case of being cancer. So patients should prepare in advance before they have a PSA blood test. And many times we unfortunately see that patients do not receive these instructions. So 2 days before the test, there are a couple no-nos that men should be given before they have a PSA. And the first thing is that they should not have any vigorous exercise happening a couple of days because it will increase levels, temporarily after there is intense exercise. So jogging, cycling, anything where there is a lot of cardio output, but your normal day-to-day activities are okay. The other thing that should be avoided is no sexual intercourse, even more specifically, no ejaculation, because it can change and increase the PSA levels, which could then lead to a false positive result. All right, let's talk a little bit about testicular cancer now. So, in the last 40 years, testicular cancer among young Caucasian men has more than doubled. It can develop at any age, but what's interesting is that it most commonly develops between the ages of 15 and 34. So, whereas we saw prostate cancer occurring later in life after 50 with Black American or African American men, we see testicular cancer affecting Caucasian men who are younger. With testicular cancer, if it's detected early, the nice thing is that it has an exceptionally high cure rate. Now, most cases are detected by men themselves, either by accident or during a TSE, which stands for testicular self exam. And just like women should undergo BSEs, which are breast self exam, men should go undergo a monthly testicular self exam because it's really important in detecting any masses or things that could potentially be testicular cancer. So, there, just like with every other disease, right, there are certain factors that can increase the risk of a male developing testicular cancer. The first is if they had cryptorchidism, which you might remember from med term, is when the testicles remain undescended. So, in a normal baby boy, the testicles develop in the abdominal cavity and they descend or drop into the scrotal sac. But sometimes this doesn't happen, and the testicles remain undescended in the abdominal cavity. The other thing would be a family history of testicular cancer, or if a male has already had testicular cancer in one testicle. So again, in Caucasian males, testicular cancer is 5 times more common than in African American males. So we kind of have this inverse relationship between prostate cancer, right, and testicular cancer. Because of the importance and because the testicular cancer affects young males, we want to start educating them that they should start performing a TSE monthly starting at age 15. And for males, since they don't have a menstrual cycle, we should just choose a date that's easy to remember. So the first day of the month is usually best. And the best time to perform a TSE is after a male takes a warm bath or shower, or even during a warm shower, because the skin around the scrotum relaxes and becomes soft, and it's much easier to palpate. And sometimes when a patient is showering, utilizing soap or things makes it easier to palpate. And what we're looking for here would be a small, hard, painless lump about the size of a pea that's either on the side of the testicle or the front of the testicle. And if a if a male finds a small, hard, painless lump, they would want to be instructed to report this to their provider, but to not panic because it doesn't necessarily mean they have cancer. The provider will just need to have them come in and do some further evaluations to make a determination of what's going on. Remember that the body can create lumps and things that actually are cysts or different things that are not cancerous. So it's important to have that diagnosed by a medical provider. Okay, that's it for now. And thank you for joining. And we will continue on now with our introduction to the clinical lab.